and I would like to thank you for coming for this webinar. And I am very happy that quite a lot of people are interested in children's mental health. And then yeah, so I started Happy Finland last year actually, because I was supposed to be a kindergarten principal last year, my own kindergarten. But then COVID-19 came in, and then everything went down the drain. And then, but I didn't stop there. I turned it into an online platform where I can also teach students online. And then, what drew my interest in this topic is because everything was online. A lot of parents and a lot of students had issues to, how to say, get themselves comfortable in front of the camera, to attend classes. A lot of parents had a lot of headache running classes for their kids. And at the same time, kids are not learning enough. Yeah. And then one day I had a very bad experience where one of the parents scolded the child in front of me online, and she started using, she started using vulgar words to scold the child. So I wasn't happy about it. So that's why I found Dr. Lennie and Adelaide online, and they were willing to do this for us today. I'm so grateful for that. So yeah, so maybe we can start with it.
Sure. So I would like to welcome also Dr. Lennie Soo to spend maybe an hour or two about this health talk about children. And we are from Persatuan I Inspire. We are the mental health advocate, and Dr. Lennie Soo is a neuro counseling psychologist, and she's expert in mental health, and her passion is to hack humans' mind. So now I pass the baton to you, Dr. Lennie.
Hi, everybody. Good afternoon, and thank you for taking your time out on a very busy Sunday to participate in this webinar. Our goal at Persatuan I Inspire, and also my personal goal as the clinical director for 360 Wellness Hub, is to nurture mentally healthy child. And we have noticed that a lot of children is struggling at this moment, and the system is not set up to encourage their mental health development. So the first thing I like to talk about is what is actually, how do children grow? All right, how do children grow from a psychological perspective? So when we talk about how children grow from a psychological perspective, really what we are talking about is developmental milestones. Now, developmental milestones in children is usually pretty much the same. So, and milestones basically means what a child can do by a certain age. And if there is a delay, that means there is a developmental delay. That means that child may have problem, may be struggling, and may need extra help. So milestones are just, a way to track what a child can do in a certain age. And most child develops their skills, they develop their abilities roughly the same order. But of course, we are all individuals, so there is a bit of variation from child to child. All right. I think I would like to introduce you to an app if you are a new mother, or if you are a physician or a medical doctor, or if you're also a psychologist. I'd like to introduce you to an app that has been created by the Center for Disease Control, surprisingly, right? So the Center for Disease Control created this app to track the developmental milestones of children. And it's actually a fun app, all right? Don't take it too seriously, but it's a fun app. And for new mothers, they will be very interested to see, oh, what is my child doing this month, and the next month, and then the next month. And it's kind of fun to do. So the app is called the CDC Milestone Tracker. You can download it from either, if you have an Android phone, from your Play Store, or if you have a Apple phone, you can download it from Apple Store. So just download this app. But this app, remember, is only for those who have children from the age of 2 months to 5 years old. So if you have kids in that range of age, then feel free to download this app. It's kind of a fun app to have. All right. Moving onwards, the first thing I think I'd like to highlight today is the impact of harsh words on children. Now, a lot of parenting involves verbal, right? We are verbally expressive towards our children. But we need to be a little bit careful about the words that we use, because these words really, really have an impact on the child. And to demonstrate that, I'd like to share with you a video of the IKEA experiment. Now, many of you here today would have seen this video before, but no harm in sharing this video again and to refresh our minds about how what we say to the child, whether you're a teacher, whether you're a parent, whether you're an aunt, what we say to the child really matters. And if we say something harsh, it can really have a tremendous harmful effect on the child, and it can affect the child psychologically. So without much further ado, let me share the video with you. So is your parenting style a bullying style? If harsh words can do that to plants, what has it done to your child? Have you ever thought about it? When you are scolding your child, have you ever thought about the implication? And the reason why I'm highlighting this is because children take things literally. If you tell a child that the water is hot, they will not assume that it is not hot or that it's lukewarm. They will assume that it is hot. If you tell the child the water is cold, they will immediately accept what you're telling them and think that the water is cold. So they take things very literally. They don't filter things. And that is why, we often find that children are very innocent. They are very innocent because they do not filter things. But because they do not filter things, the way we talk to an adult and the way we talk to a child must be different, because we know we are dealing with a human being that has no filters. All right. So keep in mind the video that we have just seen. And then after that, I'm just going to share with you another topic. The next part here is I want to just kind of like find out a little bit about what is your parenting styles. Now, in order for me to find out what is your parenting styles, I'm wondering whether you could just type it in the chat box and let me have a look at it. Like, type in the chat box what you think your parenting style is. This is for parents. If you feel free to participate, or if you're a teacher, just feel free to participate by thinking, oh, what is my teaching style? What is my go-to style? Now, all of us have a go-to style. So just pick one that you think is most relevant to your style. And I know that mothers are super self-aware. And so, I know that you are very, very aware of your parenting style. Just pick it and just write it in the chat room. Just let me have a look and just see. I'll give you maybe like 30 seconds or a minute to do this. Edmund Fong, discipline and order. Very good. Discipline and fun. Yes, of course. Authoritative, Persis, authoritative parenting. Shavinder, freedom with discipline. Subhatra, discipline lovingly. Very nice, very nice. Anyone else wants to share their style, their parenting style with us? Dale, freedom, always wanting to know if they're okay, happy, all right, okay. Very eclectic. Good, good. And as you can see, there is absolutely no, which style is good and which style is bad. And these are just different methods that everybody is using to the best of their ability to get to the point, to the outcome that they want, which is most parents have only one outcome that they want from their child. That is to nurture a child that is functioning well and who is mentally healthy. So well done. Yeah. So that is some of our sharing. All right. So remember your parenting styles. Remember what you have wrote. Remember your parenting styles. Okay. And now I'm going to share with you from a psychological perspective, like when you go and see a psychiatrist or when you go and see a mental health specialist like myself or a psychologist. How would they view your style, and what does the research says about the different parenting styles? All right. So just let me minute here. Now, but before I share that the differences in the parenting style, I would like to talk a little bit about early childhood mental health. And when you're watching this movie that I'll be screening, I would like you to think about your parenting style and think about whether you need to adjust your parenting style a little bit or not. Okay, let's start. So this is done by the Harvard University.
What do we want for our children? What's our goal? Our goal is to have productive citizens that are going to be part of thriving communities. So how do we get from here to there?
As we grow up and as we move into becoming functioning members of society, our mental health is an important part of how we perform our responsibilities as adults. Mental health can't be separated out from cognitive development and language development and kind of social competence. And they all have their roots early on in either a very sturdy or a weak foundation.
We certainly know that infants and very young children can exhibit behaviors, emotional behaviors, motor behaviors, which are predictive in certain cases of subsequent mental illness.
What are the early signs of mental health problems?
I think that when people look at children and think about mental health problems, that they have in mind often is the kinds of mental health problems that we see in adults. They're looking to see the equivalent of a depressed adult in a child, or the equivalent of a schizophrenic adult in a child. And I think that because of the nature of development, that when children have mental health problems, they just look different.
Some of the early signs of greater risk for mental health problems are usually not called mental health problems by people. They're usually called, things like behavior problems, or a child who has difficulty controlling his emotions. Some of these may be early signs of what might be a mental health problem later, and some of which may be just differences among perfectly healthy children.
So what does good mental health look like in a child?
Good mental health looks like a child who's curious and interested in the world and wants to learn and can sit and reflect at times about what's going on. It's the ability to experience love, affection, emotions, get upset when things are upsetting, and bring yourself back into levelness without needing intense intervention.
How do mental health impairments develop in early childhood?
21st century science at the molecular level is very clear that all aspects of brain function are the result of an interaction between genetics and experience. Mental illness, as most people think about it, has a very heavy genetic component. Mental health, behavior, personality, also has a genetic component, but it's much more malleable in the face of environmental influences.
Genes and experiences, as far as nature is concerned, are just different ways of setting up operating systems, brain systems, neurons.
What happens when a child experiences what we call toxic stress, severe experiences that can be damaging to its developing architecture? Those toxic experiences essentially create this unstable environment, this unstable foundation.
If sound mental health provides a foundation of stability for a child's development, mental health problems can be thought of like a wobbly table. With a child or a table, there may be many reasons for instability. Identifying which factor is causing instability is the first step towards solving the problem. So how do we restore stability to a child's mental health?
We can detect the early signs of instability. Recognizing what these signs are provides the child with the opportunity then to be placed with healthcare professionals who are trained to develop a more balanced set of skills on the emotional control side.
The prescription is to provide support for parents and in that environment in order to reduce conflict, and that in turn will lead to a reduction in dysregulated behavior in the infant and young child.
Most potential mental health problems will not become mental health problems if we respond to them early. Providing the right kinds of supports and intervention early on will reduce the extent to which this will be a potentially more serious problem later.
So thank you. And what do you think of that video on mental health? How do you feel about it when you watch that video on mental health? So the interesting thing that they have said about this is they have said, what do we want from our children? Most parents want their children to be productive, functioning individuals who can contribute back to the family and community. I think that is the basics, right? We all want that. We all want children that are fully functioning and who can contribute back to the family and to the community. So just now, I asked you to assess your own parenting styles. And some of you have participated in this, and I would like to thank you for your participation. Now I'd like to share with you from a psychological perspective, the 4 parenting styles that if you go to any psychologist or any psychiatrist or any child developmental expert or developmental psychologist, these are the 4 parenting styles that they would probably categorize your style under. So the 4 parenting styles are permissive, authoritative, neglectful. I don't think the fact that all of you are here today, that you will be a neglectful parent, and authoritarian. And each of these parenting styles, according to Deanne Bombridge, a developmental psychologist, researchers, Stanford University researchers, Eleanor and John, these parenting styles pretty much cover almost every type of parenting styles, and that these parenting styles produces a different type of child. That means these parenting styles mold the children in a very different way. So which style is yours? All right, so let's say if you say that your style is an authoritarian style, that means you are parent driven, you have very strict rules, and you have, you know, like the carrot and the stick, right? Very strict rules about punishment. You have one-way communication. It's like, I tell you to sit, you sit, with no considerations of a child's social, emotional, and behavioral needs. So this is an authoritarian method of parenting. Now, these kind of methods of parenting will produce a certain change, a certain molding in the child, all right? A certain developmental, psychosocial, psychological molding of that child. And we will discover a little bit more about those, each of these individual styles a little bit more. And as we go through the slides, just kind of think about your way of parenting or your way of teaching or your way of dealing with children and see which one you fall under. We all have a bias towards one, all right? So the first one that I'd like to share with you is permissive parenting. So let us find out more, a little bit more about permissive parents. These are the common traits in permissive parents. They are highly responsive. There is very low demandingness. That means they do not demand very much from their children. Communication, they communicate openly and usually let the child decide for themselves rather than give direction. Like they will ask the child, what do you want for lunch? You know, would you like to have this or this? You know, rather than say, you're going to have vegetables for lunch, right? Rules and expectations are either not set or rarely enforced, and typically goes to great length to keep their kids happy, sometimes at their own expense. So these are the parents that will give up their happiness for their children. And let's say if they are in a toxic relationship or in a toxic marriage, they will stay in the marriage for the children. So permissive parents are more likely to take on like a friendship role rather than a parenting role with their kids. They are their children, they are trying very hard to be their children's friends, all right? And they prefer to avoid conflicts. They don't like to fight and will often give in to their children's pledge or their children's distress. And so these parents mostly allow their kids to do what they want and offer limited guidance or direction because they're trying so hard to be friends with their children. And in this kind of cases, you know, the child naturally might tend to see their parent as someone that they may not be able to rely on, because a lot of the decision making is actually has been passed down to a child that may not actually be able to make those kind of decisions for themselves at that point of time. All right, so this is permissive parenting. There is no right way or wrong way, right? I mean, when it comes to parenting, but and a lot of this parenting also depends on the mental state of the parents. That's why when we come to developmental psychology and child psychology, we don't only look at, I mean, a good therapist would not look only at what is wrong with the child, but they will look at what is wrong with the parents. And it's not so to blame the parents, but it's more like to be able to look at a bigger picture, because the child cannot verbalize properly and express what they are feeling or what they are sensing. And so it is important as their therapist to see the bigger picture. Another type of parents is what we call the authoritative parents. Now, these kind of parents, they are highly responsive, but they also have high demandingness. That means they are quite demanding of the children, even though they are very responsive. They kind of set clear rules and expectations for the children while practicing flexibility and understanding. These particular parenting styles require a lot of effort. It requires a lot of patience. All right. They communicate frequently, they listen, they take into consideration child's thoughts, feelings, and opinion. Can you imagine how much effort that would take? All right. But this is the kind of parents they are, the authoritative type. They allow natural consequences to occur. For example, a child failed the quiz when they didn't study. Okay, well, you failed the quiz because you didn't study. But they use this opportunity to help the child to reflect and to learn. So authoritative parents are nurturing, supportive, and often in tune with their children's needs. They guide their children through open and honest discussion to teach values and reasoning. And kids who have authoritative parents tend to be self-disciplined and can think for themselves. But this particular authoritative parenting style can be quite challenging in today's modern world, where mothers are supposed to go out to work, and fathers will come back feeling very tired. So, but in reality, if this can be practiced, then I think this would be the best way to parent a child. The next one I want to talk about is neglectful parents. Now, neglectful parents doesn't mean that the parents don't love the children. It just means maybe they are too involved in their own life. They are too involved in their own stress that they don't have time for the children. So they are very, very non-responsive. They make no demands on the children. Basically, the child is on their own, right? The child is on their own. The child is parenting themselves. And they let their children mostly fend for themselves, and perhaps because they're indifferent to the children's needs, or are uninvolved or overwhelmed by other things. They offer very little nurturance, guidance, attention, zero, right? It's always, oh, you do whatever you like, oh, don't worry, they will get over it, this kind of things. They don't want to take the responsibility. Often struggles with their own self-esteem issues and have a hard time forming close relationships. All right. So these are sometimes referred to as uninvolved parenting, and can often happen with divorced children. You see the children come over to the house only on the weekend. There's not much bonding between the child and the parent. And because of this, there is not much feelings or anything involving. So sometimes there's this feeling of being, of neglecting the child, not on purpose, but just, as a matter of fact. So this style is exemplified by an overall sense of indifference. Neglectful parents have limited engagement with their children and rarely implement rules. A lot of times because they themselves are overwhelmed. I know a lot of, B40 people, B40 parents are in this category. They are so overwhelmed, that they don't actually have time to pay attention to the children because they themselves are barely surviving. And they can also be seen as cold and uncaring, but not always intentionally, right? Parents do not intentionally do that to their children. But like I said, they are often struggling with their own issues. And the last parenting styles is the authoritarian parent. Now, this is quite an, I think a lot of us who are in their 50s or 60s, we would grow up with this kind of parenting style, because a lot during those days, this was the style that was recommended. So very, very demanding, tiger mom, low responsiveness, all right? Enforces strict rules with little consideration for their kids' feelings or social, emotional, and behavioral needs. So they will, instead of allowing their children to go out and play and socialize, they will sit their children to do tuition for 12 hours, for example. Often said, because I say so, when their kids question their reason behind the rules and consequences. Every time the kids say something, they will say, because I say so, you do it. You just do it, right? Communication is mostly one way, parent to child. So that they don't care what the child's opinions are. They don't care what the child thinks. It's just, I tell you to do this, you do this. So this kind of parenting style is kind of rigid, right? It's kind of rigid. It uses very stern discipline, and it's often justified as tough love. And in an attempt to be in full control, authoritative parents often talk to their children without wanting input or feedback. Now, these kind of parents, it's not that they are bad parents or that they are, thing, but sometimes they are dealing with their own anger. They are dealing with their own imbalances in terms of emotions within them, or they may be just, passing down. This is how they were brought up. And so now they will bring up their children in a similar way. And if you tell them, don't be so harsh on your child, they will say that, no, Ken, the child is good. Like I remember when I was much younger, and my mom used to take me to the tuition teacher, and she will say that, if she's naughty, please cane her, and later on when I moved overseas to study and realized that, wait, that's a form of abuse. I didn't know that, right? So for me, it was like a very authoritative way, but that's the old style. This kind of parenting created pretty much my generation, and whether it's good or bad, it's history will tell us, right? Whether our parenting styles are good or bad. But when we talk about history, we talk about society. And basically, as parents, you are bringing up the next generation. And whether this generation do good or bad, you have the power to determine that. That is your gift as a parent that the universe have given to you. The universe have given you the power in your own small way to decide what the world is going to be like in the future through your children. So your parenting styles is molding your children. So choosing the right parenting styles may actually, help to mold the society of the future. All right. So very important role. And unfortunately, being a parent, it is the valuation of parenting is not well established, especially in Asian countries. And I think that we should actually place more value on the role of mothers who stay at home to take care of their kids, or fathers who are single father. I think their role and the value of their role has been undermined by this overarching need, to just create children that may or may not be able to fit into society. All right, so having gone through in more details the 4 parenting styles, what you will see that is each parenting styles have a different effect on child's behavior and can be identified by certain characteristics as well as degree of responsiveness. And degree of responsiveness simply means the extent of which parents are warm and sensitive to their child's need. How warm and sensitive are you to your child's need? and the demandingness, the extent of control that parents put on their child in an attempt to influence their behavior. And I want you to just remember that whatever that you're doing to your child, there is a cause and effect mechanism at play. You do this, this is the effect. You do this, this is the effect. You do this, this is the effect. So that's why parents, I think, one of our parenting courses, group parenting courses, is to teach mindfulness to parents, because I think as parents, you have to develop mindfulness skills, because if you're not mindful, the effect might not be what you want when you're molding your child. And similar with teachers, yeah. So let us talk now a little bit, go more into deeper details about how do we detect if something is wrong with your child. So at what age can you observe that something is wrong with the child? Now, earlier I showed you the video, and like what the video says, right? What those researchers says is that you can actually observe that something is wrong with your child from a very, very early age, from 2 months. They are just somehow, if they have a problem, they're just different, right? They're just different. But to do this, to observe it and to, at a very early age, you need to be super observant, and your bonding with the child must be very strong. If your bonding with the child is not strong, then it will be harder for you to observe whether there's something wrong with the child until much later. And the way when I talk about bonding is really about time, right? Spending a lot of time with them. And like what the researcher says that I showed you earlier, what determines our operating system is, number one, is genes. So there is a genetic element to this. And it's very interesting, this genetic element. When I'm a trauma specialist as well, so when I hear this, when I read this kind of research, what comes into my mind is trauma. And trauma can be handed down 3 generations. So let's say if your child is very, very anxious from the time that it was born, it's just very anxious, right? Now that anxiety, the child is just born, right? How would that child be so anxious? Where does that anxiety come from? How would the child even know how to be anxious, right? Well, the answer is probably because of trauma that has been passed down to them 3 generations. That's really interesting. And this, you can Google this kind of research, intergenerational trauma, and you can read all about it. A lot of researchers are working on this, especially from our neuroscience, perspective. And we really have discovered that trauma actually can get passed down. We know for sure 100% that it can be passed down 3 generations, but more than that, maybe some of the traumas, I don't know. And so what determines our human operating system is 2 things. One is genes, another one is our experiences. So the experiences that a child have in life is very important. And when they are growing up, who provides them with these experiences? Their parents, you. The teachers, you, right? The doctors, you. So as people that interact with children, you are the one that provide them with their experiences. And every experiences and every interaction with the child is an experience. And if the child has got more good experiences than bad experiences, then it's easier for the child to trust people. If the child has more bad experiences than good experiences, it's less likely that the child will develop trust. Okay? Now we talk about genes and we talk about environmental factors like experiences influencing the operating system of a human being, especially of a child. And when the genes develop, the genes is the one that gives the foundation of the operating system. The experiences is the one that determines the quality of that operating system, how effective that operating system is, how functional that operating system is. Now I'd like to talk to you a little bit more, but before I go into further on genes and experiences, I'd like to talk to you about stress and how stress affects the development of our brains. This is not just a child, but everybody's brains, right? How it develops and how it impacts the development of our brains. So what happened to our brains when we are stressed, and why is it important to know? Now I'm going to show you some fMRI slides of a brain that is not stressed and also a brain that is stressed. And I want to point out that, you can see very clearly the differences between a brain that is stressed and a brain that is not stressed. Now, over long term, the stress changes, and that is where, we need to be a little bit aware not to allow these changes to be in a negative, to happen in a negative way that is going to have a lifelong impact on your child. Okay. So what you're seeing on the slides now is the first slide, the big one, is the unstressed brain and the stressed brain. And you can see it involved the frontal cortex. The frontal cortex and the amygdala. The amygdala is what we call, where if you look at the middle of your forehead, the amygdala is just behind that. It's like some people call it the third eye, and then the frontal cortex is just the front portion of your brain. So the unstressed one, there is a tight control of thoughts, emotions, and action. That means there is control. The prefrontal cortex is working perfectly well, and there is a control of thoughts, emotions, and actions. Now remember, our brains do not fully develop until we are about 30 years old. But even when we are from young, the prefrontal cortex does continue to develop until we're 30, right? But in this development, if there is a problem during that development, this development of the frontal cortex gets shifted, gets changed, right? And that's not a very good thing, because then it can create anxiety, depression. It basically creates a, it predicts the problems that we're going to have later on in life. And when we have a stressed brain, there is weaker control of our thoughts, emotions, and actions. So we find it like people who are angry all the time, well, then their brains is pretty stressed. Their prefrontal cortex, have lost control over their thoughts, emotions, and actions. Depressed people, anxious people, right? There has been a problem, and these problems started at childhood. So if you look at the fMRI brain scan, you can see what a healthy brain and the results of chronic stress. And you will see where the temporal lobes is. The temporal lobe is here, and one is lighted up and the other is not. And and you can see in the slide at the bottom, the frontal lobe again, the VMPFC, the prefrontal cortex, is lighted up, whereas in the risky coping style, the stressed brain, the prefrontal cortex is completely dark, right? So this is the impact that stress have on our brains, whether we are a baby that is just born or whether we are 60 or 80 or 90 years old. This is happening to our brain caused by stress. So that's why it is really important as parents, as teachers, as people that deal with children, and as people that develop children and take care of the children, you really need to do it properly, do a good job, and prioritize the job that you do. And society should do that too, because otherwise, we are, our brain is constantly mutating based on our genes and experiences. So bad experiences can create that kind of brain whereby whenever something bad happens, the prefrontal cortex do not react. So, that is trauma, right? So stress do affect the brain. So think about the environment that you're bringing your child up in. Is it a stressful environment? Or is it an environment that is nurturing? All right, this is something every parent, every teacher should consider, and all those therapists who are trying to work with kids. There are 3 kinds of stress, and that's the acute stress, the episodic stress, and the chronic stress. So the acute stress happens all the time, right? And mothers, you go through this acute stress 20, 30 times a day, all right? But that is okay, because this acute stress normally do not do any harm, and it can be good for you. It can motivate you to wake up in the morning, motivate you to go and make sure that the kids are potty trained, motivate you to do a lot of things. Episodic stress is the stress that the same stress, but you continuously get it, like when you have a stressful job, like firefighting or law enforcement, where you are constantly put in a crisis situation. And this is the episodic stress. So episodic stress is when your body is starting to react to the stress. Heartbeat increases, you might be at risk, anxiety, and a lot of other stuff that is not so good. So you need to start to look for therapists, or you need to start to address the stress that you have when your stress has reached the episodic stage. And you do this because you don't want it to go to the chronic stress stage. When it reaches the chronic stress stage, this is already toxic. And this can cause psychosomatic, it can cause anxiety, it can cause heart diseases, depression, high blood pressure. It weakens your immune system. You are more likely to get COVID-19. It creates IBS. It creates a lot of physical health problems for you once it reaches chronic stress. And you can see that it is a choice, because you can see that this stress, like, you don't suddenly develop heart disease. It's an accumulation of stress. And because this stress keeps growing, at the end, then you get heart disease. And what we are finding is that people are dying of heart attack younger and younger in Malaysia. People are getting stroke younger and younger in Malaysia. That means there is something wrong with the way that we are being parented. There's something wrong with our parenting style. There's something wrong with our environment. There's something wrong with that is happening around us, because these kind of chronic stress issues are starting to happen earlier and earlier in a person's life, and this reduces our lifespan. So I would like to share a video with you on the impact of stress on a children's mental health. And this video will explain it in more details.
We have all experienced some sort of stress as children. Maybe it was a test you didn't study for, or moving schools and finding new friends. Regardless, it's important to keep in mind that a little bit of stress from time to time is healthy. It helps us grow and understand how to overcome problems we may face. However, when the stress response is triggered too many times, there can be lasting effects on the brain that carry on to adulthood. Stress plays a prominent role in the development of a child. The 3 types of stress include positive stress, tolerable stress, and toxic stress. Positive stress will show as an increase in heart rate and an elevation in stress hormones. It is short-lived and is triggered during minor stress experiences, such as taking a shot or being left in a daycare for the first time. However, with supportive adults to help them cope, children will gradually learn how to problem solve and deal with adversity, leading to the development of a healthy stress response system. Tolerable stress can be more serious. Perhaps you've lost a loved one or experienced a natural disaster. These types of situations can have potential for extreme damage on the brain, but with encouraging relationships, it will mend over time. However, things can get serious when the stress response gets triggered too many times. This threat is known as toxic stress. It is strong, frequent, and prolonged for a long period of time. The root of toxic stress can be numerous things, such as abuse, neglect, or violence. This type of stress will physically affect the brain, leaving certain parts rewired and changed. Toxic stress disrupts the development of brain structure and other organ systems, and it can even increase the risk for stress-related disease well into the adult years. The worse the experience in childhood, the greater the effects will be in adulthood. Toxic stress causes permanent damage on the brain, focusing on the amygdala, prefrontal cortex, and the anterior cingulate cortex, also known as the ACC. The amygdala, also known as the fear center, detects dangerous things in the surrounding area and tells the body to act. But it can become overactivated due to toxic stress. In other words, your amygdala is always telling your body that you are in danger, resulting in chronic stress, where one feels unsafe, fearful, and irritated. Furthermore, victims will often overreact to minor triggers because trauma sensitizes one's amygdala, meaning that fear responses are triggered by lower levels of stress. The prefrontal cortex, or the thinking center, regulates the stress response system by making things seem less scary than they really are. Outside of stress, it helps regulate our emotion and memory, as well as sensory processing, which allows us to effectively use our body in certain events, such as learning and problem solving. However, trauma causes the prefrontal cortex to become underactivated. Consequences of a damaged prefrontal cortex include difficulties with concentration, attention, and learning. This is because when we are under stress, cortisol is released from the adrenal glands on our kidneys. Cortisol is a hormone that increases heart rate, blood pressure, respiration, and muscle tension to prepare us to fight or run away, otherwise known as the fight or flight reaction. High levels of cortisol impair one's ability to think rationally or logically. So when our body is always thinking it is in danger, there will be constant high levels of cortisol in our body, affecting our ability to concentrate and learn. Connected to the prefrontal cortex, the anterior cingulate cortex is also one of the structures damaged from toxic stress. Known as the emotion regulation center, it controls the affect regulation, the ability to control and manage uncomfortable emotions during a stressful moment. A damaged anterior cingulate cortex results in difficulties with regulating emotions. For example, if someone gets pranked, they could remain scared long after the joke ends. Childhood trauma can cause many psychological issues, such as PTSD, high stress levels, and depression. However, these problems can be solved with patience, love, and care. Research indicates that supportive, responsive relationships with caring adults as early in life as possible can help prevent or reverse the damaging effects of toxic stress. One of the safest ways to solve one's trauma is over time. It's a good idea to build confidence progressively and work towards a goal in which one can feel safe again. In addition, patient and loving adults can help relieve toxic stress, as these relationships will help build trust and a sense of community within the child, resulting in them eventually learning how to overcome their trauma. Recovering can be a long and difficult journey, but with enough patience, support, and care, one can finally be free of that burden.
All right, so that's the end of the presentation on the child mental health and the impact of stress. You can see to overcome this stress, childhood stress, the child needs interaction. That is the tool that I would like to promote today to parents. You know, you need to interact with them. You need to be very physical with them. You need to hold them. You need to be, you know, you need to interact with them, and you need to socialize them. They need to be able to learn to make friends easily. They need to be able to go out there to talk, to be confident, you know. And if you don't socialize your child and you don't interact with your child, you are going to affect the development of the child's brains. It's that simple. All right. And if you do that, there will be a long-term impact on the child. For the rest of the life of this child, the child would have to live with the brain that you helped, you know, you created or you molded in that child. This is not to put the blame on parents, but, you know, as society, as an environment, as community, you know, we have to contribute equally to every child's growth, right? So there are a couple of stages of psychosocial development in a child, but today I don't have time to go through all of them. Perhaps if you're interested, we can do another one to talk about the different psychosocial levels. But today we want to talk about those who are between the ages of 4 to 7, which is the preschoolers, right? And so according to the stages of psychosocial development, during the age of 4 to 7, around that, is the initiative versus guilt stage. And the initiative versus guilt is the third stage of Erik Erikson's theory of psychosocial development. So during this stage, the child asserts themselves more frequently through directing plays and other social interactions. This is a very particularly lively and rapid developing years in a child's life. This is actually one of the most beautiful part of a child's life, right? This is the most fun part of the child's life, because this part is about the child taking the initiative. Now, a child may choose roles, like for example, when they are role playing, a child may choose roles for themselves or others within a game. And this is the beginning of initiative. They are actually taking an initiative to learn to be humans, right? Now, here is the problem. The problem is the guilt. The guilt comes into play when children make mistakes while navigating these positions, and they get a lot of negative feedback from the parents on it. So when you give them, you make them feel guilty, you make them, you either emotionally guilt them or you make them feel really bad or really guilty, then naturally these children are going to start to learn what guilt is. And this guilt, unfortunately, stays with them for a very long time. And to get over this trauma, for us who are therapists, we know how long it takes and how difficult it is. For us to help you for your child to get over this trauma, we need to do a lot of work, right? It's not impossible, but we need to do a lot of work. We need to re-socialize the child. We need to re-parent the child. It's a lot of work. Even when the child is an adult, we still have to do that. So here's another interesting thing. What if, most of the stages you do it right, but then there is 1 or 2 stages that you do it wrong? If there's 1 or 2 stages that you do wrong, that child, that particular stage will actually, according to the Erik Erikson's theory, will stay with that child as part of the child's character and personality for the rest of the child's life. And it can only be mitigated, right? Not and managed rather than changed. So if a child is placed in an environment at this stage, right? I'm talking about children who are preschoolers, in an environment where he and she can explore, make decisions, and initiate activities, they can achieve initiative. So on the other hand, if a child is put in an environment where initiation is repressed, like don't dirty your hands, don't pick that one up, don't put that in your mouth, don't touch this, don't touch that, clean your legs, don't do this, don't play with that, that is dirty, that is unclean, why are you here, clean this up, do that. If you are that kind of parents that keep telling your child all this, the child will lose initiative. All right, because you are repressing them through criticism and control, and they will develop a sense of guilt. And what is going to happen is that as an adult, they will not be able to take leadership roles. They will not be able to take initiative. They will always be followers. They always want to wait for someone to tell them to do something. And is that the child that you want, to nurture, right? That is your power to decide. As parents, as teachers, that's your power to decide. So the best thing that you need to do for your child between the age to 4 to 6, help them make friends so that they can develop healthy interpersonal skills. Let them play as much as possible, especially with other children their age. It is so important, right? Socialize them, like really socialize them. Encourage them when they role play and initiate activities with you. Like when they try to role play or initiate activities with you, don't scold them. Don't suppress their initiative. You know, don't tell them, oh, you're so silly, that is so stupid. You know, don't say things like that. Because if you do this, if you do the first, the 1, 2, 3 steps, your child will develop the ability to take initiative, ability to lead others, ability to make friends with others, ability to make decisions. This is the stage where the child learns to make decisions. So if you suppress this stage, the child's decision making ability is going to be suppressed, right? They take confidence in taking action, you know. So this is the stage, resilience in handling failures. Because when you interact with people, of course, there will be failures, and how resilient they are in handling failures depends on how you bring up your child, who is aged between 4 to 6. All right. So time spent with children is never wasted. So do spend some time with your children and talk to them and interact with them and enjoy them, because they are here already. You wanted kids, they are here already, and they're so fun to be with, you know. It's just nice to get to know them and to participate as a community, not just depend on the parents, but as a community, the teachers, the doctors, the therapists, you know, the friends, the relatives, you know, as a community, to develop mentally healthy children. Thank you so much. I'm Dr. Lennie Soo. This is my contact details. If you need to know more about me, you know, you can scan, and that will take you to our 360 Wellness Hub website, and talk to Finland. You know, I think and talk to all the teachers and the therapists that are helping your children. Thank you so much for being here today and for listening to this presentation. I'll pass the floor back to the MC.
Thank you, Dr. Lennie, for such a wonderful insight with the research and the fact base through the video teachings. And I believe that those audience on the floor, you have received so much information which is useful to you, and they'll be in your mind, oh, how those things works, or how those things going to happen to my child in the future. So the floor now is open to you all for question and answer. If you have any question, feel free to unmute yourself and throw the question. Anyone? Or I'll just read out the question from the chat box. Feel free to unmute yourself. This is a free and comfortable learning style. Okay, if not anyone, we actually have collected few questions for you, Dr. Lennie. Okay, question number 1. Is it normal for a child to cover her ears when she meets strangers or hear noises when she doesn't like, for example, like vacuum or certain music, and tend to scream in very high pitch if her regular routine has been stopped or her favorite toy being taken away? What is your thought about this?
How old is the child?
Never mentioned though.
Okay.
So
in this kind of case, we need to know how old the child is. Like say, for example, because, you know, depending on how old the child is, there is different developmental stage, right? Like I have said earlier, you know, so let's say if the child is between the age of 4 to 5, then the child is always asking, is it okay for me to do things? And what the child is doing is that the virtue is that the child is trying to develop purpose, right? Learning purpose. So of course, when they are trying to do this, then they will be quite willful. Or if the child, I think the ones that will do something like this will be around 2 to 4 years old. Because at 2 to 4 years old, they'll be asking things like, can I do these things myself, or must I rely on others? And so they are developing willpower. and so they will rebel against you because in a way that they are trying to develop a sense of independence, and they're trying to develop personal control. So their development of independence and personal control, their development of their own personal willpower may be in contrast to what you really want them to do. But but if you do this, if you parent them through this stage between the age of 2 to 4, which is the anatomy and shame and doubt stage, then your child will be left with the feelings of maybe left with feelings. I mean, if you're successful, they will be very independent and they got personal control. If you are not successful in parenting them through this, they might develop feelings of doubts and shame over their own abilities. So they might not be sure about their own abilities. So yeah, if you have a very willful child, you must remember, why are they being so willful? They're being so willful because they're asking themselves, can I do this myself, or must I rely on others? So when they're being willful, you kind of say, is this how you want to do it? Let me show you how to do it correctly. And this will actually mitigate their rebellion side, because you're not fighting against their developmental progress. You're not going against their developmental progress. You are working with their developmental stages. All right?
Okay, great. Now we have the question from the floor from Ben Wenbing. If child tend to lie when parent asks them to do something, can you state the age of your child, please, Wenbing?
Doctor, yeah, I'm here. My child is about 5 years old.
Okay.
So like example, I asked them whether you got eat something at lunch. She will say no, but when you question more, she tends to try to insist, say no. So in fact, we know that she already eat.
Okay, so again, this child is around 5 years old, right?
Yep.
Okay, so around 4 to 5 years old, they are asking, is it okay for me to do these things? They're trying to develop purpose. So your child is trying to develop a sense of purpose. Your 5-year-old daughter is trying to develop a sense of purpose and the motivation to try new things. So they're trying to learn to develop this sense of purpose and motivation, and they're trying to learn new things, right?
Yes.
And so that's why, when you ask them, have you eaten? They will say no, because they're trying out a new way of talking to you.
Okay.
They're not trying to offend you. They're trying out new ways. So the way to get past this is teach them different perspective, so that they can develop purpose. And when you are successful in helping them to develop purpose, then they will be able to feel that they can do things on their own. They will be motivated to try new things. If you don't, then they will be like, they will always be rebellious, right? So they're trying out new things, and you're stopping them from trying out new things. So the best way is like when you ask your daughter, have you eaten? And your daughter have eaten, right? But you ask, have you eaten? And your daughter says, oh, no, because she's trying out new ways to communicate with you. Isn't that cute?
Yeah, what we worry is just that later when she go up, it tends to lie. This is what we are worrying.
Yes. So then you have to teach them the difference between lying and trying new things. So you said that, okay, you can say this, this is one way to say it, but when you say it this way, this is called lying, and lying is bad. So when people ask you, have you eaten? And if you have eaten, then you must say yes. So this is where you teach them values, right? And how to actually, but you have to have a lot of patience. I know how you're feeling now. You have to have a lot of patience, unfortunately. But give it a try. Let's see how and maybe report back and see how it works for you. Okay?
Okay, thank you, doctor.
You're welcome.
Okay, and question from Paylin. I have a child 9 years old. He will show his aggressive behavior, such as hit on his head or knock something when he feels impatient. what can I help you to smoothen his aggressive behavior?
He will hit his head, is it?
Yeah, or not on something when he feels impatient.
When he feels impatient. Okay, children between the age of 5 to 12, they are under a stage called industry versus inferiority. And for them, it's all about how can I be good? And the reason why for them, how can I be good is so important is because they're trying to develop competency. They're trying to be good. They're trying to be competent, right? And of course, success leads to feelings of competency, and failure leads to feeling of inferiority. And but because they are constantly asking, how can I be good? How can I be good? It can be very frustrating for them when they cannot do something. When they cannot do something, and it sounds like your son is a little bit frustrated. That's why he keep knocking his head on the wall, right? And the best way to stop him from knocking the head on the wall is to be able to teach him how to do things properly, and to encourage him and to acknowledge his success when he does something correctly. So your acknowledgement, you seeing that he's success and rewarding him not with toys or not with things, not with material things, but with a hug, with a smile, with a good word, will really help him will really make him feel like, oh, I am doing this right. And doing this right is so important for a child between the age of 5 to 12. Can you try that?
Okay. Aileen, do you get that, Aileen? I hope you did get that, yeah.
Yeah, Aileen, thank you so much for that question. Thank you. Very good question, Aileen.
From Ms. Daleta, could you share some characteristic of an autistic children?
Characteristic of an autistic children. Autism is in a spectrum, and of course we have certain we can say that, okay, this particular child is autistic based on I'm just trying to be a bit careful here, because autistic is in a spectrum, and I don't really want to label a child too young, right? I don't want to label a child as being autistic too young. And autism is a neurodevelopmental disorder. All right, that means there is something when they are born, that time they are born with a little bit of a neurodevelopmental issue already. And often you will notice a couple of things. Now, if we are talking about autism specifically, there is the signs, the early signs and symptoms of autism is very, very wide. For example, ASD kids might have only very mild symptoms, or some of them may have very severe behavioral problems. But every single child with autism experiences problems, one or more of the following, right? If they are very young babies, infants are usually very interested in the world and the people around them. Like babies are very interested in the world and the people around them. But a child with autism, an autistic child, may not be interested and have difficulties interacting with the world around them. So like they don't have any interest in their toys, they don't look you in the eye, they don't, they don't like you to come near them, that is the kind of symptoms in babies that you will observe. And toddlers usually like to interact with people and with the environment, right? I mean, toddlers, right? They like to interact with the people, they like to interact with the environment. But if your child kind of like don't want to go out, don't want to interact, doesn't like you to, doesn't, it's not responsive when you call their names, They don't imitate your facial expression. They don't reach out when you want to pick them up. They like running into the walls or close to the walls. They want to be alone or have solo play. I mean, they are different, right? They are different, or they become very obsessed with one thing. They keep repeating the same words or the same action over and over again. They keep hurting themselves. They have huge tantrums. They display very high sensitivity to things like smell and taste. They are very, very picky eaters. These kind of things are kind of like some of the symptoms of that they may have some problems. But I think for autism, if you feel that your child has a problem, it's very important to get the child diagnosed very early. So, bring them to see a psychologist, or, our center provide that kind of assessment to get that assessed very quickly, so that we can actually, rectify some of the issues and make them into high functioning autistic adults. I hope that answered the questions.
Yeah, okay, sure. Next one. Parents concerned for children's mental health during the pandemic, and parents are still afraid to send their child to school when it's open. So it's kind of like stress.
Parents, sorry, say that again.
Sure, the parents are concerned about children's mental health during this pandemic and still afraid to send them to school when the school is open.
Okay, of course, the reality of the COVID-19, the social isolation, all that is understandable, right? I mean, we all understand that there is a problem. We all understand the implications of such a problem. But if your child is between 4 to 5 years old, this is the time where the only way to develop the brain is to let the child interact and play and socialize. So if there is a big gap between, the worry about the COVID-19 and also the worry about the developmental stages of your child's brain. So you have to decide as a parent which is more important. Whether sending the child to school for interaction, for social interaction, in order for them to develop their brain is more important, or keeping them at home free of COVID-19 is more important. Of course, you must make sure that that the teachers and the schools follows very, very strict SOP. But when children catches COVID, their symptoms are normally very, very light, even with the Delta variant. I mean, they don't suffer the impact of COVID the way that, say, an adult do or an old persons do. Normally, COVID impact the oldest, the people that are over 55 years old more than any other groups. And children are the one that has got the least impact in terms of recovery. It's like smallpox, right? Like if you get chicken pox or smallpox when you are a baby, you don't even remember it. It doesn't have much effects on you. But if you get chicken pox or smallpox as an adult, it can kill you, right? So the older you are, when it comes to virus, children are very, very resilient to virus, and it's the adults that needs to worry about that. So as adults, maybe if your children are going to school, you worry about yourself first. It's like the same rule that applies in the aeroplane. You put the mask on, the oxygen mask on yourself first before you worry about your kids. So worry about yourself first, keep yourself safe first, and then only worry about the kids later. All right, and don't allow your anxiety about the kids going to school to impact the growth of the kids' brain's development.
Okay, cool. I think adults have to calm themselves down before they can calm their own children. All right.
Something like that, yes.
We have Subhatra Rajamani. First time asking a question. As a preschool teacher for the past 15 years, I experienced some students would lie to parent about the thing happened in school, eating or studying, and when the parent come back to us teachers to complain, they tend to trust their kids more. How to deal with these kids?
How old are your kids?
Subhatra?
She said preschool teacher, that means preschool.
Preschool, that
4 to
means 4 to 5 lah, right?
4 to 6. Yeah.
4 to 6, okay. All right, so these children, like I said just now, to that gentleman that asked the question about their thing, is that they're trying different way of they're trying to develop a sense of purpose. They want to try new things, and this is something new. Life is something new to them. So basically, the teachers need to educate the parents of that their child is going through this stage. And once the parents and the teachers are aligned on this one, then it is easier to help the child develop their sense of trying new things within the safety and boundary of social acceptability. So I know, I mean, you are the second person that talk about the children lying. They are not lying. I mean, they're just, to them, they don't know what lie is. They don't know what is the meaning of lie. They don't have a agenda or an ulterior intention, or they're not trying to be manipulative. What they're trying to do is their brains is trying to now teach them or want them to try new things. And so lying is something that is the new thing for them to try. So as teachers, you need to inform the parents of this, and then parents and teachers, you need to work together, maybe sit together with the child and tell the child, we know that we know that what you're saying, we know that you're trying this new way of talking, but lying about about your teacher or lying about something is not the right thing to do. And slowly, the first time, it won't work. The second time, it probably will work better. The third time, it will work completely. So, because it's not the purpose, the child is just trying something new. And so here is a good time to teach the child, as they are trying something new, what is right and what is wrong. So the moral compass of teaching must go through, the entire stages of development.
All right, so like they are just having fun with their own brain, right?
Yeah, they don't know that they are lying. They don't know that they are being manipulative. We see it as, oh, they are being manipulative, that they are lying to me. But to them, they're just trying a new way of thinking, a new way of exploring personal relationships.
See. Okay, next question.
But you have to be strict lah. You have to be, you have to have a chat with them. You say, this is not right, and they might be seeing their parents or their teachers do that as well, because these children at 4 to 5, they mimic the adults. So, they're learning to lie from somewhere.
Okay.
They're learning to be, manipulative from somewhere. Maybe, so you need to be very mindful of your white lies, because remember what I said, they take things very literally. So if you say to them, okay, if you do this, I will buy you an ice cream, and then they do it and you don't buy them an ice cream, you are lying, right?
Yes.
You are lying, and they will remember this. And to them, because they don't know this is a lie, right? They don't know this is lying. To them, that, okay, so in the future, when I want but I don't want to do something, I will do the same thing. I will follow this way. I will say, Daddy, the teachers call me so that I don't have to go to school, because
like
I learned this from my
Yeah.
parents. I learned this from my teacher. You don't have to teach them by words. They see what you do, and monkey see, monkey do.
Yes, agree.
Yes. It's
Yeah.
like they learn the pattern. Is that they don't know what is lying, but they learn, oh, this is how it works. And then they practice it in other ways.
Right. So
Interesting.
if you want to know what the parents are thinking, or the relationship of the parents, or what kind of people the parents are, you can just observe them through the actions and reactions of the children. I mean, from a psychological, profiling perspective.
Actually, it's quite obvious to us as a preschool teacher by observing how the kids talk, how the kids react,
Yes.
socialize. By 90%, we already know, oh, what kind of parent that it will be that we'll be dealing with.
And the most important thing is you need to see this, and then after that you need to make the changes, make the adjustment for them so that they can grow up to be functioning, well-balanced, mentally healthy adults. You
So-
cannot just leave it,
So communicating with parents still is a key point.
Communicating with parents is key, because every child must be brought up by the community, not by the parents alone. The parents alone cannot bring up a child. Millions of years of human evolution, always in until very, very recent, until less than 150 years ago, children are brought up by the community. Even in Malaysia, the longhouse, the children are still being brought up by the community. It's only recently that the children are being brought up by their parents and not by the extended family or the community. So we are going against millions and millions of years of human evolution by changing this pattern of parenting. So now since we have already changed it, we have to take into account how we can, what we can do to go back, or to revert back to what, because our body and our mind don't care what we change. They have their own pattern. From a neuroscience perspective, our body and mind develop in their own pattern. They're not going to change the pattern overnight, because we humans decided that we no longer want to live in a longhouse. We no longer want a community parenting of our kids. We want our kids to be parent on our own. In fact, some parents even homeschool their kids. So, because of all this, we are actually going against, from a neuroscience perspective, from a psychology perspective, going against the normal developmental progression of the child's mind and brains.
Oh, that's so sad.
Unfortunately, yes. But this is the reason why I agreed to come and give this talk, because I feel that this is an issue that not many people want to face.
Yeah, I can correlate it to it, because during my growing years, we are running wildly in a kampong. So all the kampong, we have all the neighbors, right? So all the neighbors know each other. So when I went to another kid's house, then we do all the nonsense, right? The auntie will come and report to my parents, then kena lah. So from that kind of group socialite, like community, we know where's the boundary, we know how to talk, we know when to stop, that kind of thing. But I don't see it nowadays. Nowadays, more like, buy an apartment and then go into a micro family, just parents, and not even their grandparents are together with them, which is, I find that, frankly, this is how their behavioral has not as complete as to our era.
Yeah, and also because this kind of upbringing builds a lot of feeling of threat. Like there's a lot of threats to them. There's a lot of, the children don't feel safe.
Okay.
And
yes.
They don't know how to feel safe. That's the saddest thing. They don't know how to feel safe.
Yeah, one step to the house, maybe, this will happen, that will happen.
And more kids now don't know how to socialize, right?
Yes.
Yes.
Yeah.
Okay, I can take one more question, and then after that I need to go.
Oh,
All right.
can I ask a question?
Sure.
I have a few students who tend to hit their parents when they don't get something, especially during online class, because I do a lot of online classes. When the mother suddenly walk away, she needs to drink a cup of water, and then no, and then they start hitting the parents. They turn off the computer and they hit the parents. Not only for during online classes, sometimes before the class start, I come early online and they will be playing, and then their parents will, okay, it's time to study, and then they take away their toys, and then they start hitting their parents. So is that a phase where kids start hitting people, or is it normal? Uh, what should
It's
I
normal
do?
for them to throw
Yeah.
a tantrum, but the hitting part is something that as parents and teachers, we have to stop them from doing by saying here is where we have to teach them what is right and what is wrong, right?
Yes. But if the parents don't do at their own home, that's
I
how
think
can I help? Yeah.
as preschool teachers, you need to educate the parents as well as the child.
Yes. Okay.
Right? So it's more about educating the parents and saying that, hey, actually, I just saw your child beating you. Does that happen very often? Does it happen very often? And if it happens very often, what have you done to stop this behavior?
So one way is to try to talk to the kid, tell the child, okay, you are hurting mommy. What are you feeling? Like asking them, is it?
Correct.
Yes.
And another thing is to approach it through the parents. Sometimes
Okay.
a lot of parents, they just overwhelm the child so much that the child is fed up of it, because remember, at the age of 4 to 5, they want to play.
Yes.
And then you ask them to sit 6 hours in front of the computer listening to an adult. Who wants to do that?
Yeah. Even an adult don't want.
An adult don't
Yes.
want, right? So don't
Yes.
expect the children to do what you yourself cannot do or
Yeah.
don't want to do or don't find it. You got the best way for the brain to develop when they're 4 to 5 is playing with their friends, playing with other people, exploring things, so that they can develop purpose, and the first thing that a child develop from 0 to 2 years old is hope. And they are always asking themselves, because I told you babies are always very curious about the world and curious about people. From 0 to 2 years old, they are always asking, can I trust the world? This is a new place that I came to. Can I trust this place? So they are always a bit wary. And if they develop a sense of trust, then they will become more caring, and they will feel that people are more dependable. And then at the age of 2 to 4, they are always saying that, can I do things myself or must I rely on others? So this is the anatomy and shame thing. Here is where you're teaching them to maybe potty training them, and they are asking, okay, potty train, because you can't potty train them when they're too young. But around 2, like that, you can start to potty train them. You can start to stop them from, wetting the bed and all that. And because this is the stage where they're asking themselves, can I do things myself or must I rely on others? So you give them the confidence to do things on their own. And of course, then the 4 to 5, is it okay for me to do these things? And they will push your boundaries. Like the child that hit the parents is pushing the boundaries. Is it okay for me to hit my parents? The answer is no. Then you must tell them no, and you must teach them no. Because when the question is it okay for me to do this, they're going to try to do many things to annoy you, to upset you, to irritate you. And your job is to guide them and tell them, okay, this thing that you're doing is good, yay, this thing that you're doing is bad. All right, and let me tell you why it's bad, blah blah blah. So you explain to them, you chat to them like that, in a very not authoritarian but authoritative style.
Thank you.
Okay?
Thank you for answering all of our questions today.
No worries, no worries. Okay. Thank you so much for inviting me. I really appreciate being here. And thank you so much for for paying attention. And yeah, if you all have any other questions and all that, I think you can ask Dale for my contact number, and you can contact me. Thank you so much, everybody.
Hold on. I have something to share as well. Before we end, let me go through this. Yeah. So I have been conducting our online art class that we do for kids because they don't have any interaction with the outside world yet, because they're all at home still, right? So that's why I have all these kind of group classes where kids can still interact with their age group peers, not their grandparents or parents, people more adult than them. So yeah. So this art class will be about more of storytelling, telling them stories about animals and plants, more to environment-based art class, and then they will do the art as well, together with me and their peers. So this group will be about maximum of 5 to 6 students only, to make sure that everyone has the chance to speak. Yeah, we want them to speak as much as possible, interact with their peers. Yeah. Okay. If anyone is interested, you can say that you're interested in the feedback form that Adelaide just sent in the chat, and we will be very grateful if you can fill in the feedback form. It will help us in our next free webinar session. Okay.
All right. So thank you very much, especially
you,
Dr.
everyone.
Lennie and all the audience. We have learned so much about the brain development and neurological science as well being included. So I hope that everyone will take this seriously, especially this pandemic period of our children mental health. And we are hoping to see also parents spread it all out to others friends that you all know. Okay. And I would like to end today's session by doing a countdown from 5 to 1. Then we'll just say goodbye. All right. 5, 4, 3, 2, 1. Goodbye.
Bye.